So you've heard the news. There are COVID-19 vaccines that are available, and the data shows that they actually work and prevent COVID-19. Many of you are ready to roll up your sleeve and put your arm out and get vaccinated, but there are a lot of you who have questions, and that's completely normal. The most often question that I get from my friends and my family and colleagues and patients is, am I going to be vaccinated? And my answer is absolutely, as soon as it's my turn. So there's a lot of you ask is, how come information changes? And the reason for this is because the beauty of science is that it evolves with the data. It evolves with knowledge. So science isn't black and white. Science is grayscale. It's a collection of grays that lead the answer to be more black or more white. So the goal of this talk is to explain what RNA vaccines are and how they work. The second is how effective and safe are these RNA vaccines. The third is the initial plan of priority and timeline. And the fourth is question and answers to many of your questions. So what's an RNA vaccine? So really it's a combination of the central dogma of life, which is DNA to RNA to protein plus immunology. So I'm going to give you an analogy, and that's why I have all the Lego out here, and I'm not sponsored by Lego doing this. Okay, so we're in our family, we're going to make this Lego, a gingerbread house. And so if you look at the whole Lego manual, which is like pages and pages long, this is like the DNA. It's the overall instruction manual. But the RNA is like the mini instruction manual to make part of this big structure. And specifically, we're going to make this Christmas tree over here. And the Christmas tree is like the protein. And then the little tiny Lego blocks that make up the protein are the amino acids. So if you only had the instructions to make the tree, you wouldn't be able to make this entire gingerbread house. So that's basically the concept behind this RNA vaccine. We're giving the cell instructions only to make the Christmas tree, which is the SARS-CoV-2 spike protein. Now, if I gave the instructions, okay, to the cell like this, so the RNA directly naked to the cell, it would be immediately degraded. So it's sort of like if I, when this comes in the package, it doesn't come as a paper book, it comes inside a plastic bag. And the reason for that is to prevent anyone spilling anything on it, water, destroying it. So the same thing is happening with the RNA. They actually take the RNA and they wrap it in sort of like plastic lipids, which are fats. And then that is injected. Now, the RNA that's wrapped in the lipid particle gets injected into the muscle, and then it gets taken up by the immune cells. And they're like, oh, this RNA, I know what this is. I'm going to make something. I make a protein out of this. So it goes and it makes this protein. But it looks at it, the cell, and says, I don't know what that is. That's not me. And so when it knows that it's not itself, because our body is trained and our immune system is trained to know what self is, it goes and puts this on the surface of the cell. And that then recruits all the other B cells and T cells to create an immune response. Now that RNA, by the way, is just like this paper book. It's not very stable. It's not going to last for a long time. So within a couple of weeks, that RNA is gone. And you have the body reacting to this protein on the surface that again also goes away, but that memory of the B cells and the memory of the T cells stays. And then what happens is if your body in the future encounters the SARS-CoV-2 virus, which causes COVID-19, your body's like, hey, I know that Christmas tree. That is not me, Christmas tree. I'm going to attack this Christmas tree and prevent the virus from replicating. So overall, this is not the entire virus. It's one protein. You can't get COVID-19 from the vaccine. Just like if I only gave you the instructions to make the Lego Christmas tree, you would not be able to make the whole gingerbread house. So my second point is how effective and safe are the RNA COVID-19 vaccines? So there's two vaccines, one that's approved, it's the Pfizer BioNTech. You've also heard it by the name BNT162b2. They looked after up to 112 days after inoculation, and there's really has to be 2 doses, the first dose and then 21 days later, a second dose. And you have 95% efficacy in preventing a symptomatic COVID-19 infection. There's no change in efficacy based on age, ethnic origin, or comorbidities that are known to be involved in having worse COVID-19 outcomes. The adverse effects from having the vaccine are sort of more than a flu vaccine, but not as much as the shingles vaccine. So there's going to be pain at the injection site. That's about 84% of people have that. There's fatigue, 60%. Some people have headache, a good 50% of people have headache. Some people have muscle pains and chills. Fever, it's about 14%. However, as we all know, getting COVID-19 is worse than this. What's also very interesting with these vaccines is you actually have better immunity than with a natural infection. Both an antibody, so B cell mediated immunity, and a T cell cell mediated immunity. The other issue is the Moderna vaccine. That's one that hasn't been approved yet, but it's about to be approved. That's also made by NIAID. Its name is mRNA-1273. And there's protection against infection up to 12 weeks. Again, it has very similar efficacy of 94%. It's similar across ages, genders, ethnic origins, and comorbidity. What very interestingly they show is it actually prevents severe COVID, and it works after one dose, although to less effects, and it works in those that already have COVID-19. There's a very small amount of data showing that about 60% prevent an asymptomatic infection, therefore prevent transmission. But the idea with all these vaccines is that if you prevent symptomatic infection, you're going to prevent spread, because we know that the most people that spread have symptoms. Again, the side effects are very similar to this vaccine. Pain at the injection site is like 90%, and then fatigue and headache and so on, and muscle pain. There's also been shown some lymphadenopathy, so that's like lymph nodes that are swollen. That happens in about 21% of people under 65 and 12% of over 65. But some of that makes sense because that's where our antibodies are made, is in our lymph nodes. There's been no anaphylaxis or severe hypersensitivity seen with this virus. Now, what we don't know, the length of protection. We only have data up to 112 days. We don't have long-standing data. We don't know what happens in special groups. So people under the age of 16 were never tested in these studies. People that are breastfeeding, that were pregnant, very few HIV positive patients were tested in these. Some of these actually, in retrospect, have a few of these members, and they are being analyzed currently. Does it protect against asymptomatic transmission? It's presumed, as I mentioned, but it's not known, and we need to have more data, and more data is being collected on this. And as I mentioned, the Moderna vaccine does prevent 60% of asymptomatic infection actually after only one dose, and we're still being investigated what happens after 2. But overall, what this means is even with vaccination, the tenets still stand of distance, hygiene, and masking. So my third point is initial plan on priority and timelines. Compared to usual protein-based vaccines like seasonal flu, these RNA lipid nanoparticle vaccines are much more fragile. Because of the RNA, they actually need to be kept at very low temperatures. So the Pfizer vaccine has to be kept at -80, the Moderna vaccine at -20. Because of that, we need to really work and make sure we have a very good distribution system that's centralized. And so Public Health Canada and the individual provincial agencies like the NSPQ, as well as NACI, so the National Vaccine Advisory Board, are all working together to have very clear, so that we don't waste any vaccine. The plan is to go for those in long-term care facilities, the healthcare workers in those facilities, as well as healthcare workers that are working with people most at risk, people in isolated communities, and then by descending age throughout the community, as well as comorbidity. The trial sites have actually already started in Canada. In Montreal, closest to us is Maimonides, started on the 14th of December. The rollout for us of healthcare workers is actually planned before Christmas. The next point is some questions and answers. So can the COVID vaccine be given with other vaccines? And right now the answer is no. We actually have to wait after you've had another vaccine for 2 weeks before getting the COVID-19 vaccine, and then we wait another 28 days afterwards. And the reason for that is we want to make sure you have a good immune response to the individual vaccines that you're receiving. Can pregnant women get the vaccine? So they weren't included in the trials intentionally. They were not included. There were, after the fact, found out that there were 23 people in the Pfizer trial that were pregnant, and those pregnancies are coming. However, this is not a live vaccine. This is a RNA vaccine, and therefore is not expected to be an issue. It's supposed to be decided on a case-by-case basis. So mainly if you're a pregnant healthcare worker, that may be something you would discuss with your physician. Can breastfeeding women get the vaccine? They weren't included in the trials again. More data is coming, but really overall, it's considered to be not a problem, and that it would not affect both the mom that's breastfeeding and her breastfeeding infant. Can children get the vaccine? So the Pfizer vaccine is only approved for greater than 16 years old, and we'll have to wait and determine when we're going to start vaccinating younger than that. Another good question is, do elderly develop a good immune response? Generally, older people don't develop as strong as immune response, but what has been seen in the Pfizer and Moderna studies is no difference across ages. So definitely elderly people should be vaccinated. Do immunocompromised develop a good immune response from the vaccine? So they weren't included in the trials, but it's not a contraindication. And it's likely that they will have a response, but won't be as robust. Can the vaccine, can you get it if you've already had COVID-19? And yes, actually, the Pfizer trial had 4,000 people who already had the COVID-19 actual virus and were cases with symptoms. And they, after they had been fully finished their isolation and finished their COVID-19, were able to get the vaccine, and they had similar immunity to the rest of the trial. What if you're allergic? So there's no absolute contraindication, but those with a history of anaphylactic allergy, there's a warning, and a risk-benefit analysis needs to be done with your healthcare provider. The exact mechanism of why there were some instances where anaphylaxis was seen in those that had severe anaphylactic allergy. And when I talk about that, it's having anaphylaxis requiring an EpiPen shot. Can this RNA vaccine be incorporated into our DNA and change our cells? The answer is no. So human cells don't make reverse transcriptase. So in order to be able to take this RNA and put it into our cells, we would need to take this RNA and be able to make the DNA, the whole book. And our cells don't have that ability, as well as our cells can't take that DNA and have something called an integrase to integrate into our genome. So that's just not possible. How long will immunity last? That's another great question. We don't have data beyond 3 months. It's expected that it lasts longer than that, but at the moment we don't know. However, if we can have greater than 70% of the population vaccinated, that will create a herd immunity, and we will be protecting everyone, and therefore not having COVID-19 anywhere to be able to replicate or live. What are the long-term side effects? Well, we don't have data beyond 3 months, so we don't know. But right now, everything is actually looking very positive in terms of that after 3 months, there are no long-term side effects of the vaccine. Now, we all do know that having COVID-19 has long-term side effects. So at the moment, it looks much more promising to get the vaccine than to get the virus. And then the last point I want to make is that we have better immunity from the vaccine than we do from the virus. So I encourage you all, when it's your turn, to get the COVID-19 vaccine. Thank you.